This is the introduction module for pharmacy code and trauma training. A code is a medical emergency involving a patient, visitor, or employee within Children's of Alabama. This may also be referred to as a resident physician. A code or a resident physician may be called from anywhere within the children's facility. It could occur in a patient's room, in the emergency department, in the crosswalk, in the lobby, or in the parking deck. Pharmacy will be notified of a code through the overhead paging system. An overhead page will go out announcing the resident physician and will provide the location of the event. Pharmacy may also be notified of a code through the Volt system, trauma pager, or phone call. People responding to a code or resident physician will include a pharmacist, a pharmacy technician, the wards team, PICU team, respiratory therapist, X-ray, chaplain, and the specific group of physicians caring for the patient. Often security will also respond to assist with crowd control and to help facilitate a path for patient transfer. The pharmacist and the pharmacy technician will respond to the code with a code bag, refrigerated narcotic box, and the syringe and needle bag.
Pharmacy's here.
When the pharmacy team arrives at the code event, they will announce their arrival, obtain patient information, establish a workspace, and determine which physician is in charge of the code. This could be a member of the wards team, PICU, or a doctor from the subspecialty team caring for the patient. Once the pharmacist has established who is in charge, they will listen for medication orders. The pharmacist should begin completing the pharmacy code charge sheet. This document will be used to document the doses of medication given and the administration times. This sheet also contains the patient's name, medical record number, estimated weight, and a brief description of the events, including the location of the event, the date, start time, ending time, pharmacist, and physician. The pharmacy technician will assist the pharmacist with the transportation of the code bag, refrigerated box, and the syringe and needle bag. The primary role of the pharmacy technician is to listen for the pharmacist to communicate medication orders to them and prepare medication as needed. The technician should be familiar with basic pharmacy calculations and have a clear understanding of how to calculate a correct dose using the patient-specific dose and the concentration of the stock medication. Code events usually involve patients who are already at the hospital. Children's is also a Level 1 trauma center. The difference between a code and a trauma is that usually the trauma is coming from the scene of the event and may arrive at Children's by ambulance or life flight. The pharmacy will respond to Level 1 traumas. A Level 1 trauma is the most serious medical event, and the patient may present with life-threatening injuries. Traumas take place in the emergency department in the trauma bays. When pharmacy is notified of a Level 1 trauma, we usually get a little more information about the situation prior to going to the emergency department. This general information could include a brief description of the injuries, the patient's age, patient's symptoms, and estimated time of arrival. A Level 1 trauma will be run by the emergency department physician until the surgery team arrives. Once surgery arrives, they will be in charge of the code.
Pharmacy's here.
When the pharmacy arrives at a trauma, we will announce our arrival, establish workspace, determine which physician will be giving medication orders, obtain or verify patient information, and begin completing the code charge sheet. Begin drawing medications and listen and wait for directions from the physician. The most important patient information needed by pharmacy initially is the patient weight. You may have to wait until the situation is under control to obtain a patient label and more information. Common situations for code or traumas may include, but are not limited to, rapid sequence intubation, full arrest, status epilepticus, head trauma, narcotic drug overdose, severe asthma causing a respiratory emergency, or severe injury due to an accident or serious weather event. During codes and traumas, medications are obtained from the code bag, PICU, or the main pharmacy. Many times, the physician will ask pharmacy to come with them to CT or when transporting the patient to the ICU. At the end of the event, the physician in charge will dismiss the pharmacy. Once the pharmacist and technician return to the pharmacy, if the code bag was opened, the bag will need to be restocked and the proper pharmacy keeper documentation should be completed. Also, any supplies that were used need to be replaced. The pharmacist should ensure that all documentation is complete on the code charge sheet and that all medications have been properly charged. If the medication came from the code bag or pharmacy stock, it will need to be quick charged in the electronic medical record. If the medication was removed from the PICU, then it was charged upon removal. Any narcotics that were used during the code or trauma will also need to be properly wasted. If the medication was removed from the PICU, it can be wasted through the PICU with a witness, usually the pharmacist and the pharmacy technician. If the narcotic was used from pharmacy stock, it will need to be wasted through the C2 safe. Document how much was given and how much was wasted with a witness. The pharmacy code charge sheet can be found in the front pocket of the code bag. The pharmacy bag contains 2 individual boxes. One is specific to cardiac events and one that contains common medications that may be needed for pain, intubation, seizures, or reversal of medications. The larger portion of the bag also contains bulk items that may be needed, such as bags of fluids, flushes, or items that are too large to fit into the smaller containers. Once the documentation is complete on the pharmacy code charge sheet, this form should be properly filed in the pharmacy department. This concludes the introduction module. You may review it at any time.